Good evening everyone, and thank you for being here. Today, we're going to discuss an important but often overlooked diving risk: immersion pulmonary edema, commonly known as IPO. While many of us are familiar with dangers like decompression sickness and oxygen toxicity, IPO is a condition that can affect divers of all experience levels, often without warning. IPO occurs when fluid unexpectedly builds up in the lungs due to immersion in water, making breathing difficult and potentially life-threatening. Unlike other diving-related illnesses, IPO can happen even in shallow water, and to otherwise healthy individuals. In this session, we'll explore what causes IPO, how to recognize the early warning signs, and most importantly, how to reduce the risks and respond effectively if it happens. Understanding this condition could help save a life, maybe even your own. So, let's dive in. It is now recognized that IPO is probably the commonest cause of death in recreational scuba divers. It is the commonest cause of death in triathlons. The exact number is unknown, as many deaths are attributed to drowning, when actually they are caused by IPO. Post-mortem findings are almost identical. IPO regularly features in swim tests performed by the Israeli Defense Force, the UK SBS, US Navy SEALs and French Navy divers. It is often reproducible if that person has to repeat the training. Immersion pulmonary edema, IPO, is a critical condition for scuba divers because it can occur suddenly and be life-threatening. It happens when fluid builds up in the lungs, due to increased hydrostatic pressure from immersion in water, combined with factors like cold water, exertion, and predisposing health conditions, such as hypertension or heart disease. Divers experiencing IPO may struggle to breathe, feel chest tightness, and develop a persistent cough, sometimes producing frothy or blood-tinged sputum. These symptoms can be mistaken for other diving-related issues, delaying proper response. Unlike decompression sickness, IPO can occur even in shallow water, and without breathing compressed gas. Recognizing IPE early is crucial, as continuing to dive can worsen the condition. Immediate actions include stopping exertion, surfacing safely, and seeking medical attention. Oxygen therapy can help, but severe cases may require hospitalization. Understanding IPO helps divers recognize symptoms, manage risks, and avoid potentially fatal consequences. Immersion pulmonary edema, IPO, can be triggered by a combination of physiological, environmental, and individual risk factors. Understanding these can help divers reduce their risk. Key risk factors for IPO: 1. Environmental and dive-related factors, cold water diving. This triggers peripheral vasoconstriction, forcing more blood into the lungs. Deep or long dives. Increased hydrostatic pressure can raise pulmonary circulation pressure. High work of breathing. Strong inhalation effort, due to a tight wetsuit, high resistance regulator, or rapid breathing, increases negative pressure in the lungs, drawing in fluid from the blood circulation. Preload increase from equipment. Tight wetsuits, dry suits, or buoyancy control devices, BCDs, can restrict venous return and elevate lung pressure. 2. Physiological factors. Hypertension, high blood pressure, increases pressure in lung capillaries, making fluid leakage more likely. Heart conditions. Left ventricular dysfunction, coronary artery disease, and valvular heart disease can impair circulation and fluid regulation. Overhydration. Excess fluid in the bloodstream can increase pulmonary capillary pressure. Cold water exposure causes blood vessels to constrict, increasing central blood volume and lung pressure. 3. Individual factors and triggers. Overexertion. Swimming against currents or carrying heavy gear increases cardiovascular strain. Pre-existing lung conditions. Asthma and other respiratory issues may contribute to breathing difficulty. Anxiety or stress can lead to hyperventilation and increased cardiac workload. Aging. Older divers may have reduced cardiovascular efficiency, making them more prone to fluid imbalance. Medication use. Certain drugs, for example beta blockers or diuretics, can affect fluid balance and cardiovascular function. By recognizing these risk factors, divers can take proactive steps to minimize the chance of experiencing IPO and ensure safer dives. Early signs and symptoms of IPO. Recognizing IPO early is essential for preventing serious consequences. Common symptoms include 1. Difficulty breathing, dyspnea, feeling breathless despite a normal dive profile, worsening shortness of breath even at rest. 2. Persistent cough, dry or wet cough that develops during or after a dive, often accompanied by a feeling of tightness in the chest. 3. Coughing up frothy or blood-tinged sputum. This is a key indicator of fluid in the lungs. Pink or white frothy mucus suggests pulmonary edema. 4. Chest tightness or discomfort not related to gas expansion injuries. Can feel like pressure or heaviness in the chest. 5. Reduced exercise tolerance. Struggling to swim or feeling exhausted without excessive exertion. Weakness or sudden loss of energy. This progresses onto severe symptoms. 6. Worsening of shortness of breath, often gasping for breath. 7. Confusion, dizziness, or cyanosis, bluish lips or fingertips. Signs of low oxygen levels, hypoxia, may be accompanied by lightheadedness or confusion. 8. Feeling of drowning even at the surface. Some divers report feeling as if they are drowning from the inside. Anxiety and panic may follow. 9. Finally, loss of consciousness will occur. Many of these symptoms can occur for a variety of reasons, and the diver often either prefers to believe that it is a more benign cause, or simply is not aware of IPO. This is the chest X-ray of a 40-year-old female BSAC instructor, who developed symptoms of IPO on a club diving trip in Plymouth Sound in 1977. On the boat was a young doctor who provided assistance and got the diver to the accident and emergency department. On the left, the chest X-ray shows a lot of white fluffy patches in the lower part of each lung. Following treatment with diuretics, she rapidly improved, and the X-ray on the right is several hours later, which is back to normal. She reported that this had happened several times before, but always got better with time. IPO was not a recognized diagnosis at that time. Preventing immersion pulmonary edema involves managing risk factors, optimizing dive conditions, and ensuring divers are aware of early warning signs. The key strategies are: 1. Maintain good cardiovascular health. Control blood pressure. Hypertension increases the risk of IPO. Regular monitoring and medical management are essential. Manage heart conditions. Divers with heart disease, left ventricular dysfunction, or arrhythmias should seek medical clearance before diving. Avoid overhydration. Excessive fluid intake before a dive can increase blood volume and pulmonary pressure, contributing to IPO. 2. Optimize dive preparation. Avoid overexertion. Plan dives to minimize excessive swimming, especially in cold water or strong currents. Use a low-resistance regulator. High work of breathing can increase negative pressure in the lungs, drawing in fluid. Wear properly fitting gear. Tight wetsuits, dry suits, or BCDs can increase venous return to the lungs, elevating pulmonary pressure. 3. Be cautious in cold water. Use adequate thermal protection. Cold exposure triggers peripheral vasoconstriction, increasing central blood volume and lung pressure. Acclimatize to cold water. Enter the water gradually to allow the body to adjust. Shorten dive duration in cold conditions. Reducing exposure time may lower the risk of IPO. 4. Recognize early symptoms and act promptly. Be aware of warning signs. Unexplained breathlessness, persistent cough, or chest tightness should never be ignored. Abort the dive if symptoms occur. If any signs of IPO develop, ascend safely and exit the water as soon as possible. Seek medical attention immediately. Even if symptoms improve after surfacing, medical evaluation is crucial to prevent complications. 5. Medical clearance and fitness to dive. Regular health checks. Divers, especially those over 40 or with known cardiovascular risks, should undergo routine medical assessments. Review medications. Some medications, for example beta blockers or diuretics, may contribute to IPO risk and should be evaluated by a doctor. Be honest about health conditions. Undiagnosed or unmanaged conditions can significantly increase IPO risk. If you or your buddy experience any of these symptoms, stop exertion immediately and seek to surface in a controlled manner. Signal for help and alert your dive buddy or boat crew. Exit the water as soon as safely possible. Administer 100% oxygen if available. Keep warm. This encourages vasodilatation. Seek emergency medical assistance even if symptoms improve. Never give fluids. The prognosis after an episode of IPO. Many will not survive to get out of the water. If they do so, then the outlook is good, if managed appropriately. As IPO is usually a recurring problem, then many would recommend no further diving. Closed-circuit rebreather divers are particularly susceptible to immersion pulmonary edema, due to several unique factors associated with rebreather diving. While IPO can occur in all divers, CCR diving introduces additional risks that can increase lung stress and fluid accumulation. The key reasons why CCR divers are at increased risk of IPO are: 1. Increased work of breathing. Higher resistance in the breathing loop due to scrubber material, one-way valves, and counterlungs makes inhalation more effortful. Increased breathing resistance can cause negative pressure in the lungs, drawing fluid from the pulmonary capillaries into the alveoli. This is pulmonary edema. 2. Negative pressure breathing. Unlike open-circuit divers, CCR divers do not receive pressurized gas on demand but must actively draw in each breath. This can create negative intrathoracic pressure, further promoting fluid accumulation in the lungs. 3. Increased hydrostatic pressure differences. When a diver's counterlung position is below the level of the lungs, for example in a heads-up position, extra effort is required to inhale. This hydrostatic imbalance can exacerbate negative pressure breathing, increasing the likelihood of pulmonary edema. 4. Longer dive durations. CCR divers often conduct longer, deeper dives, leading to prolonged immersion and increased central blood volume due to vasoconstriction. Cold exposure during extended dives further exacerbates pulmonary capillary pressure, heightening the risk of IPO. 5. Undetected symptoms due to gas composition. CCR divers breathe high oxygen partial pressures, which can mask early symptoms of hypoxia caused by IPO. Unlike open-circuit divers, who might feel breathless due to CO2 buildup, CCR divers may not recognize breathing difficulty as quickly. 6. Overhydration before diving. Some CCR divers overhydrate to counteract dehydration risks associated with extended dive times. Excess fluid increases pulmonary blood volume, making IPO more likely. Prevention strategies for CCR divers. 1. Optimize work of breathing. Use well-maintained and correctly configured rebreathers to reduce breathing resistance. Position counterlungs as close to the lungs as possible to minimize hydrostatic pressure differences. 2. Avoid overhydration. Hydrate adequately but avoid excessive fluid intake before a dive. 3. Monitor for early symptoms. Be aware of unexplained breathlessness, persistent cough, or chest tightness, even if breathing feels normal. 4. Minimize cold water exposure. Use appropriate thermal protection to reduce vasoconstriction, and limit dive durations in very cold conditions. 5. Ascend and exit water if symptoms appear. Any signs of IPO warrant an immediate, controlled ascent and emergency medical assessment. Those that subscribe to diving magazines or online diving websites will probably have come across many articles about divers who have died, IPO being given as the cause. This graph is taken from the BSAC annual incident report, showing the number of cases of IPO that they are aware of. Many of the previous year's possible or probable cases have been reclassified on review of the original incident report, and IPO rated as the likely cause. Dr. Sally De Corsi developed IPO and became unconscious at the surface in 2023. She was successfully resuscitated. With hindsight, it was obvious that she had experienced several incidents of IPO on previous dives. The underwater filmmaker John McIntyre developed a near-fatal episode of IPO in 2017. He had previously been treated for IPO, subsequently being investigated for high blood pressure and treated. His return to diving nearly cost him his life. Richard Stansfield was participating in a deep course in 2016 at Stony Cove dive site when he died. His instructor was accused of manslaughter for allegedly holding him underwater, on his safety stop whilst he drowned. 4 years later he was cleared, when the cause of death was changed to IPO. Earlier on, we looked at the chest X-ray of a diver with IPO. The young doctor on the dive boat, who successfully treated this lady, was Dr. Peter Wilmshurst. He subsequently became a world-renowned cardiologist with a particular interest in diving medicine. He has made significant contributions to scuba diving safety, particularly in the understanding of immersion pulmonary edema and decompression sickness. 1. Research on immersion pulmonary edema. Dr. Wilmshurst was one of the first researchers to identify and describe immersion pulmonary edema as a distinct and serious condition, affecting divers and open water swimmers. His contributions include establishing that increased hydrostatic pressure and cold water immersion contribute to the fluid buildup in the lungs, leading to IPO. Demonstrating that pre-existing hypertension, heart conditions, and overhydration increase IPO risk. Raising awareness that IPO can occur even in healthy divers, at any depth, and in both open circuit and rebreather diving. Advocating for early recognition and management to prevent fatalities. 2. Work on patent foramen ovale and decompression sickness. Dr. Wilmshurst also played a key role in researching the connection between patent foramen ovale, a small hole in the heart, and serious decompression sickness in divers. His studies showed that divers with a large PFO have a higher risk of neurological DCS, as nitrogen bubbles can bypass the lungs and enter the arterial circulation. He helped develop screening recommendations for PFO in divers who experience unexplained DCS, and advised on when PFO closure might be necessary for safer diving. 3. Advocacy for diver safety and ethical medical research. Dr. Wilmshurst has been a strong advocate for diver education, helping increase awareness of medical conditions that can impact diving safety. He has challenged unethical practices in medical research, ensuring that diving-related studies are based on sound scientific principles and accurate risk assessments. Impact on scuba diving. Dr. Wilmshurst's work has directly improved diver safety by increasing awareness of IPO and its prevention in diving communities, influencing screening and management guidelines for divers with PFO, advancing research in diving medicine, benefiting both recreational and technical divers. His contributions have saved lives by helping divers recognize early warning signs, manage risks, and make informed decisions about their diving fitness.